we're in an environment where most of the physicians in this country are paid in terms of their volume or productivity. So the more patients they see, the better they're paid. And that may not be the right model. It just may not be the right model.
It is called a fee-for-service system, and the kinds of services that we sell, I think, make us often lose sight of the reason patients should get or might need those services. Nobody wants an MRI. People come to my office and say, I want an MRI, but they don't really want an MRI because the MRI doesn't make your knee feel better, it doesn't make your shoulder feel better. It's a step towards something that might help you. In having a system that pays doctors for specific services, doctors wind up being pressured to provide those services. They wind up confusing those services with things that may be of real value to patients.
Doctors who are paid fee-for-service and are very mindful of the need to be able to pay their rent and pay their staff often feel enormously pressured to be seeing many more patients per unit time than they might feel comfortable with. Doctors who work in a very large organization where scheduling can be inflexible might feel like they have very little control over being able to say, you know, for the following patients, I think I need a little bit more time because I know it'll pay off in the long run.
There are many times when a telephone call from me does a lot more than actually seeing the patient. It doesn't take very long. It's not reimbursed. It's not considered a part of my productivity, but it's the right thing. So there are many other examples of that where we could do things smarter, but we're confined by how productivity is measured by our employers and by the financing system.
The part of fee-for-service payment that I think poses the greatest challenge for professionalism is it has created a healthcare delivery system or helped support a healthcare delivery system where physicians and other types of health professionals and institutional providers operate in silos, more or less independent of one another, even when they're caring for the same patient. So a seriously ill patient may have not just one physician, but may have a dozen or 20 physicians. But fee-for-service payment has allowed those individual physicians to treat the patient independently of one another. Now, good professionals, despite the payment system, will collaborate and integrate and coordinate the care. But that doesn't always happen. And we need a payment system that supports the active coordination of physicians in providing what I would consider to be truly professional care.